Does your big toe joint hurt when you walk? Is your big toe stiff and hard to bend? Now you might have big toe arthritis, also called hallux rigidus. In this video, we're going to figure out what's actually causing your pain and most importantly, what you can do about it to start feeling better today. You're going to learn how to spot the signs of hallux rigidus, find the right shoes to make walking easier, and discover simple exercises to keep your joint moving so you can stay active and comfortable. And you're going to want to stay till the end of the video because I'm going to share some common pitfalls and some traps that people fall into when trying to treat their hallux rigidus. I'm also going to talk about when to even consider if surgery might be the best option for you. So let's start by figuring out what's actually causing your pain. Once you know that, you can stop guessing and start the healing process. So here's some common causes of big toe pain. Gout. With gout, you have sudden onset of pain, redness, lots of swelling around the big toe joint. Usually the pain's worse at night. If your symptoms come and go quickly, or they get worse with certain foods or drinks, especially red meats or alcohol, gout may be the cause. A bunion. Well, what's a bunion? Well, a bunion is a bump on the inside of your foot just behind the big toe joint. And this is where that first metatarsal bone drifts away from the other metatarsals and the rest of your big toe drifts in the other direction, forms a V shape, and creates this bump on the inside of your foot. Now with a bunion, also called hallux valgus, the pain is usually going to be much worse with shoes, and the pain's usually located over this area where the bump is. It's often not as painful when moving the big toe up and down. Now sesamoiditis. You might have sesamoiditis if your pain is at the bottom of your foot, at the ball of your big toe. Now this is where that first metatarsal head resides and where these two little sesamoid bones are going to live inside your great toe flexor tendon. And this area can get aggravated, which causes pain at the bottom of your big toe. Now hallux rigidus is what we're focusing on today. This is one of the most common and frustrating causes of big toe pain. Now hallux limitus is basically a less severe form of hallux rigidus. It's actually a little more complicated than that, but I'm going to cover the differences between these two terms in another video, so subscribe to the channel so you don't miss this one. So this is the point where we need to get clear in the diagnosis, because knowing if you actually have hallux rigidus is going to help you take the next best steps to getting better. So let's figure this out together. Here's a quick at-home check. Sit and bend your big toe upward toward the top of your foot. You should be able to bend your big toe joint upward to at least 60 degrees and up to 90 degrees without pain. Limited motion at the joint or pain when doing this could mean you have hallux rigidus. Now here's some other clues that your problem is hallux rigidus. If you have a lot of pain with pushing off of the big toe during your gait or your walking, if you have swelling or a painful bump at the top of the joint behind the big toe, or if you've noticed that you're changing your gait and you're basically trying to avoid bending your big toe when you walk, these are clues that you're probably dealing with hallux rigidus. Now the reason hallux rigidus happens is arthritis wears down the cartilage of the joint, and it wears down the top part of the joint first, and then bone spurs form at this area. When this happens, the joint can't move as it normally should, and it causes pain. Now let's talk about shoes, because wearing the wrong shoe can definitely make things worse, but getting the right shoe can take pressure off of that great toe MTP joint and help you move with less pain. So there's 4 things that I look for, and the first 2 are probably the most important. So a wide toe box. A wide toe box shoe is a non-negotiable feature in my opinion. Your big toe needs room to move naturally. A narrow toe box shoe is going to push that big toe inward toward the other toes, which abnormally loads the MTP joint, and this can aggravate the arthritis, leading to more pain and more arthritis. Zero drop. So the drop of a shoe refers to the distance between the height of the front and the back of the sole of the shoe. Most athletic shoes have a 10 millimeter or 1 centimeter heel drop, and dress shoes can have even higher heel drop. Now a zero drop shoe has the same heel height as the front, which allows for a more natural gait, and this shifts the pressure of the big toe joint into the rest of the foot, into the midfoot and hindfoot. In the earlier, less severe phases of hallux rigidus, these two features alone can alleviate most or all of your pain and allow your big toe joint to keep moving. In more severe cases, the big toe MTP joint is very painful and much stiffer. In these cases, you might need to eliminate most or all of the joint motion in order to walk without severe pain. This is where the next two features really help out. So next is a stiff sole shoe. So a stiffer sole in the shoe is going to result in less extension at the MTP joint, putting less stress on the top of the MTP joint. Now, the most extreme version of a stiff sole shoe is a shoe with a carbon fiber plate built into the sole of the shoe. However, you got to be careful here. There's a lot of big brand shoe companies that have versions with carbon fiber built into their sole of their shoes, but it's mainly done for performance reasons for runners and not necessarily for walkers and for people with hallux rigidus. So a lot of these brands have very narrow toe boxes, which is going to be bad for this hallux rigidus. Also, getting a shoe with a built-in carbon fiber is going to cost you a lot more money than a shoe without it. Now, a way to get around this that's cheaper and gives you a few more options is to purchase your own carbon fiber insert and place it underneath the soft insole in your shoe. You want to make sure the soft insole is on top to give you some cushion. But this way you can get the other features of the shoe you want, like the zero drop, the wide toe box, and pick the brand that you like and still get the stiffer sole. Now the last feature that's important is called a rocker bottom. This is a special shoe that has a curve at the front of the shoe, much like the front of a rocking chair. Now a term for a rocker bottom in the front of the shoe is also called a toe spring. What this does is it allows you to roll through your step during that important push-off phase of gait when you're walking. And we can do this without bending your big toe at the MTP joint, which lessens that pain. Now I'm going to cover more details on shoe recommendations in another video. I can't go through all the details here, it's going to be too long. I'm also going to cover carbon fiber inserts, insoles, and dancer pads in another video, so stay tuned, subscribe to the channel so you don't miss this one. Now shoes help, but they're only part of the picture. We want to add in some exercises to help improve motion, ease discomfort, and strengthen your foot. So for me, these exercises fall into three categories. You got exercises to improve the mobility of your MTP joint. You got exercises to improve the dorsiflexion of your ankle. And then you got your foot strengthening exercises. So great exercise for the mobility part is to start with gentle traction on the joint. So you're going to do this by taking that big toe and with one hand pulling on the big toe away from the rest of the foot. And this is going to distract the joint. This is a great one to start with because it can unlock that stiff joint a little bit and help make the other exercises a little easier and less painful. Next, you want to gently bend the big toe down toward the bottom of the foot, and then you want to bend the big toe upward toward the top of the foot. Now, when you're bending upward, you need to be gentle because this motion is often what's the most stiff and uncomfortable, and you can certainly aggravate the joint. However, by doing this in a controlled and gentle fashion, while not bearing weight through the joint, you can increase this mobility a bit, so when you are bearing weight through the joint during exercises or walking, it's less painful. Now, the next thing I like to do is take that big toe and pull it inward toward your other foot and away from your little toes. This is really great if you have a bunion as well as hallux rigidus because it can loosen up that tight portion of the joint. But even if you don't have a bunion, the joint is usually tightest at the top and that lateral or outside of the joint. So by stretching this big toe inward away from the other toes, you can loosen this area up. Now next we're going to talk about ankle mobility, and you want to improve the dorsiflexion of your ankle by stretching your calf muscles. What this does is it improves your gait, it takes strain off of your big toe MTP joint when your foot lands on the ground with each stride. You can start with a simple stretch using a towel or a belt and pull back on the belt or that towel to stretch your calf. You can do this sitting down on the floor or in bed. Now next you can perform a stretch against the wall. Important thing here is you want to turn your toes in about 15 degrees or pointing toward that front knee so you're really getting the stretch through the calf muscles and not your foot. And then if you have a slant board, you can use a gravity stretch to really get a great stretch for both calves at the same time. Now you can do this at your bottom stair or stool if you don't have a slant board, but the slant board certainly makes it easier to get a deeper stretch, and it's easier to do this stretch without aggravating your big toe MTP joint with the slant board. Now last, we want to talk about foot strengthening exercises. We want to strengthen those little muscles called the intrinsic muscles at the bottom of your foot. Now here's the thing. These exercises for strengthening your foot haven't been proven to stop hallux rigidus from progressing, but they're still worth doing. They help keep the muscles in your foot active and strong. They help support your arch, and they help you maintain better overall foot function. As hallux rigidus gets worse, the pain in that joint often makes you use your big toe less when you walk and do other things. And some of these treatments we talked about, the stiffer soled shoes and the rocker shoes, can limit some of that natural motion in your big toe and the little toes. While this is necessary to ease your pain, you could be making your foot muscles weaker. So by strengthening these muscles through these exercises, you can counteract some of those forces that are going to happen naturally with your treatments. So the exercises that I like are marble pickups or towel curls. These are basically the same exercise, just a different way to do it. Foot doming is a really powerful exercise you can do, as shown here. And then single leg balance is critical. You can also do toe yoga and toe spreading exercises. Now, if you want more details on these exercises, I have a whole video where I go through these exercises in detail because they're also super valuable in plantar fasciitis treatment. Now, before we wrap it up, you certainly want to make sure you're not making things worse with these treatments. Here's the most common traps or pitfalls that people can fall into. First is not all wide shoes are created equal. You don't want a wide version of a regular shoe. You want a wide toe box shoe. You want good support around the ankle and the hind foot. You just need more room for your toes. Now, the other thing is some of these major shoe brands are going to market their shoes as having a wide toe box, but the toe box is still narrow, and often the rest of the shoe is still too wide. So here's a quick test. Take out the insole of your shoe and you want to stand on it. If your toes splay over the sides of the insole, that toe box isn't really wide enough. Now the next pitfall is when you're using those stiffer soled shoes or rocker bottoms, this certainly can weaken your foot muscles over time. It's good for treatment, but it has sort of this side effect. So you want to add those strengthening exercises in that we talked about into your weekly routine to help keep your feet strong. Now the third pitfall is you don't want to push through pain during the big toe mobility exercise. If it's really painful to do these exercises, which it can be in these more severe cases of hallux rigidus, this could certainly aggravate your pain. So listen to your body and scale back a bit on these exercises if it's just too uncomfortable or painful. Now, if you tried everything and you're still in pain, here's how to know when it's time to get professional help, and also what to expect if you do go get help. Now, if you've consistently followed these tips for 4 to 6 weeks without any relief, it's time to consult with a foot and ankle specialist. Now, alternatively, if your pain suddenly worsens, making it really difficult to walk or wear shoes or fall asleep at night, you need to seek medical attention as well. As an orthopedic foot and ankle specialist, I usually start by asking questions or getting a history and then performing a physical exam to make sure I got the right diagnosis. I'll often get x-rays, and this helps me determine the severity of the hallux rigidus, and I want to make sure there's not any red flags or surprises, such as a fracture we didn't know about, a bone lesion, or some other abnormality that we can see on x-ray that's not hallux rigidus. Now for short-term relief, we can prescribe anti-inflammatory medication orally or topically, or we can inject steroid into the joint, which can give you some really good short-term relief. We can also help guide you on other non-operative treatments you may not have considered, try to get you to the finish line and get you out of pain. Now, when should you consider surgery? If you've tried these conservative treatments for at least a few months without any relief, it's reasonable to at least consider a surgical option. Now, the right time for surgery can vary from person to person, but pushing through miserable pain for years is certainly not necessary. The surgical options can provide long-term relief for most people. The two most common and successful surgeries that have stood the test of time are an MTP joint chylectomy, which is removing the bone spurs at the top of the joint, and even that top part of the joint where the arthritis is most severe. And then for more severe cases of hallux rigidus, a big toe joint fusion is often a great procedure. And this is where we place hardware across the joint to get the bones to grow together. Now the joint won't move, but at least it won't be painful. Other options include a big toe joint replacement or some type of osteotomy. Now an osteotomy is cutting the bone on either side of the joint to shorten or change its position to offload the pain from the arthritis. Now the success rate of these last two options is certainly less predictable. I'll cover all these surgical options in another video, so subscribe to the channel and hit that notification bell so you don't miss out. Have a great day.